My name is Joshua Van Grootheest, and I'll be presenting acquired immunodeficiency syndrome, otherwise known as AIDS, and the key role that nutrition and healthy habits play in its treatment and prevention. So, AIDS is defined as the final, most severe stage of infection with human immunodeficiency virus, or HIV. HIV attacks the immune system over time, and when the damage becomes severe enough, the condition is classified as AIDS. At this stage, the body has a very difficult time fighting infections and certain cancers. So, a little bit about the pathophysiology of AIDS. It centers on the damage to the immune system. So, AIDS being a progressed version of HIV. HIV specifically targets CD4 plus T lymphocytes, essentially T helper cells, which are white blood cells that help in the immune response. As HIV continues to replicate in the body, the number of CD4 cells steadily declines, meaning a lower immune system effectiveness. When CD4 levels fall too low, the immune system becomes into a weakened state, leaving an individual more at risk for opportunistic infections and cancers that a healthy immune system would normally be able to control. These infections are often the defining factor in the diagnosis of AIDS. So there are several general risk factors associated with developing HIV and progressing to AIDS. These include unprotected sexual contact. This is because one is coming into contact with contaminated bodily fluids, and AIDS or HIV is transmitted via bloodborne transmission and contact. Another is sharing contaminated needles and syringes. This is because you're coming into contact with those bloodborne transmissions with someone who is contaminated with HIV. Another risk factor is perinatal transmission, where HIV or AIDS can be passed down from mother to child during pregnancy, childbirth, or breastfeeding if untreated. Also, exposure to contaminated blood products like transfusions is also a risk factor. Without treatment, individuals infected with HIV are at risk of progressing to AIDS over time. So those delayed or the lack of treatment over time can progress and be a risk factor for progressing to AIDS. Nutrition is closely related to this disease because immune function, body weight, and overall health are strongly influenced by someone's dietary intake. Poor nutrition can worsen immune response, suppression, and increase complications in health. So, some current knowledge and treatment of AIDS is current treatments for AIDS focuses on antiretroviral therapy or ART, along with supportive care such as nutrition management and infection prevention. Nutrition plays a key role in maintaining strength, supporting immune function, and improving someone's quality of life. So, some nutritional guidelines and recommendations for individuals with AIDS emphasize a high calorie, high protein diet. This is important because people with AIDS are at risk for unintended weight loss or muscle wasting, which is essentially the loss of muscle mass. Adequate calories are needed to help meet increased energy needs because they're fighting off these infections with a weakened immune system, while protein supports muscle mass and immune cell production. In addition, individuals with AIDS are encouraged to increase their intake of essential vitamins and minerals, especially vitamins B and D, as well as iron and zinc. These nutrients support immune health and energy metabolism, as well as overall body function. When intake from foods is insufficient, supplements may be recommended by healthcare providers. Along with nutrition, several healthy habits help prevent complications and improve outcomes in people living with AIDS. The first healthy habit is routine medical checkups. Regular follow-ups allow healthcare providers to monitor someone affected by AIDS CD4 counts, as well as the viral presence or load in their body. As they can also look at the nutritional status of that person to make sure they're getting enough of their nutritional needs. Early detection can find HIV and prevent it from progressing to AIDS as well with these routine checkups, as well as find infections and deficiencies that lead to quicker treatment and better outcomes. The second healthy habit is maintaining proper nutritional habits, such as eating balanced meals with adequate calories, proteins, and micronutrients to help support the immune system and prevent the weight loss that comes with AIDS. Good nutrition also improves one's energy levels and ability to fight those infections. The third healthy habit is consistent use of antiretroviral therapy or ART. Taking ART exactly as prescribed by healthcare providers helps suppress the virus. It also slows immune system damage and prevents progression of the disease. Another thing that ART does is it significantly reduces the risk of transmitting HIV to others. The fourth healthy habit involves infection prevention techniques. This includes practices like good hand hygiene, handling food safely, and avoiding exposure to illnesses when possible. This also includes vaccinations to help protect against preventable infections. Together, these nutritional strategies and healthy habits alongside medical treatment can help individuals living with AIDS live longer and healthier lives. So, AIDS is a severe condition caused by long-term HIV infection that damages the immune system, but proper nutrition, healthy habits, and adherence to medical treatment are key in managing the disease, preventing further complications, and improving someone's overall health outcomes living with the illness.